I would like to introduce Dr. Edward Barnes. He hails from the south side of the city of Chicago, Illinois. He has his family migrated to the local area in Southern California when he was a child. Dr. Barnes did his undergrad training at Whittier College in Whittier, California, where he earned his degree in biology. He then went on to earn his medical degree from the University of Kansas School of Medicine in Kansas City, Kansas. During his time in medical school, he won a 4-year Army scholarship. Once he completed medical training, he went on to complete his internship and residency with the Army at Brooke Army Medical Center in San Antonio, Texas. Dr. Barnes successfully completed his nephrology and hypertension fellowship at Walter Army Medical Center in Washington, D.C. He is also a veteran of Operation Iraqi Freedom, serving as a battalion surgeon for a tank unit commanding 32 medics and providing care for over 1,000 soldiers. Dr. Barnes was honorably discharged from the Army in 2010 when he joined Western University of Health Sciences. He is now an associate professor of internal medicine and the assistant dean of longitudinal and experiential learning at the College of Osteopathic Medicine of the Pacific. He has continued to be very clinically active as the Director of Renal Services for the newly developed Kidney Health Center, a collaborative, team-based practice that provides integrated care for patients living with kidney disease. He currently serves as the Medical Director for a hemodialysis center in Pomona, California. Dr. Barnes is dedicated to educating the future healthcare providers of America, innovating teaching styles, and integrating technology. And without further ado, I would like to present to you Dr. Edward Barnes.
So first, I'd like to apologize. I had no voice 3 days ago, okay? The other thing is I don't stay in the box well, so I may be out there with you or, walking across the stage. If I get in front of the slides, I'll move out of the way as quickly as I can. Thank you, Pierre, for inviting me, and thanks for the introduction. You gave basically the majority of my talk, so I may not be able to talk very long. So as Pierre mentioned, I work at Western University of Health Sciences. I actually heard about your breakfast with the president. I met with him earlier this week. Thanks for doing that. So I want to go through my story, not because I want to brag or say, hey, look at what I did. I want you to be able to parallel and see what similarities you might personally have to my story, and so you can see that your hopes and dreams and all the things that you want to do can actually be done and maybe be exceeded. So as we go through these slides, don't feel like this is me aggrandizing myself. It's more because I used to be where you were. I was sitting where you were, not here, but in Whittier, California. And I remember thinking and wanting some of the things that you want. So let's get started. So I'm calling this part the path, but it really is my path. It doesn't mean that this has to be your path, okay? So I think the theme of today is show a picture of yourself when you were a kid. So you can get the ahs and the ohs, and I wore a pretty fresh collar back then, as you can see. The colors of the 70s, you got to remember. That's the way we dressed. So I'm actually from the south side of Chicago. If you watch the news at all, you know that's not a place where you would think a future doctor would be coming from. I put this picture up here because there's this dual world of Chicago. It's such an interesting thing. When I tell people I'm from Chicago, they say, that's great, I love Chicago. And I'm thinking, what part of Chicago were you in? Right? Because you could see the skyline there that's really beautiful, and I don't even remember seeing that very much as a kid. The Chicago I remember, is here at the bottom right. Where, it's this underserved area where, there's a lot of conflict and just this rotational cycle of miseducation, I think about what my parents have actually accomplished for me because they got married when they were 16 years old. You know, they had my sister at that time. It wasn't like, a planned thing, obviously. And they were 21 by the time they had me, and I'm their third kid. So every time I talk to them, I'm like, I could barely wipe my nose when I was 21, let alone be a parent of 3 kids. And yet they made some key decisions that I think helped myself and my sisters out. One was getting us out of Chicago. Not because I'm saying it's such a horrible place to live. We just have a really big family there, and it just became a big cycle of miseducation, as I could point out to you. So we moved, first we moved to Culver City, but immediately moved to West Covina, California. Anybody here from West Covina? Okay, we got a few. So I went to junior high school there, and then I went to high school at a school called Bishop Amat High School. It's in La Puente. I was a football player back then, so I made sure that I used the skills that I had there to try and make sure I can escalate the level of education I was getting. But I think this was one of the transitional or pivotal points in my life, transitioning from Chicago to California. So from there, it was always said to me, you could do whatever you want to do or be whatever you want to be. And I really, really appreciate my parents for infusing that into me. Because I ended up being the very first person in my entire huge family to go to a 4-year college. And let alone going to a 4-year college and starting, but making sure that I completed a 4-year college education. Since the time I was about that picture, I had told my parents, I'm going to be a doctor, I want to be a doctor. And, and not once did they tell me this is not something you can do, okay? They made sure to know that I can be whatever I wanted to be. And so when I was trying to look at going to college, remember I told you I was a football player. So I wanted to go somewhere and play football. I mean, that was the thing I wanted to do. So I was trying to look at bigger schools, going out of state, things like that. And, my dad set me down and said, he handed me this pamphlet of Whittier College, and I'm like, where's that? and which was sad because, Whittier's not that far from West Covina. I actually knew the city Whittier, but I didn't understand what this college was. And one of the things that he pointed out to me is the way it served me well was because it was on a smaller scale. I mean, my largest class, and this is nothing against, Cal State San Bernardino. I know that the class sizes are not the same. This is a private school. I mean, I had general chemistry where we had 50 students in that class. That was my largest class. In my smallest class, we had 5 students. So you can imagine when he was talking to me, it didn't really capture to me. But then I went and visited their football program. I was like, okay, so I could play football and get a good education. So I ended up going to Whittier College, which I think was another pivotal moment in my career. Because even though I had done well in high school in academics, I hadn't really learned how to learn, and I think being at a smaller campus really helped me with learning. And so this transition from Whittier to going to medical school, this is where you guys are. I didn't have a mentor, and like I told you, I was the first person to ever go to college, let alone to say I was going to be a doctor. So when I thought I've always gotten into doing what I want to do, and so I applied to one medical school. You see how everyone giggles, right? Because I thought I was that good, right? So suffice it to say, I didn't get in because I didn't really know what I was doing. And even though we had this pre-med group at my college, I was kind of peripherally involved. So I really didn't have any guidance. So after I didn't get in when I graduated college, I was looking around for programs that would help me prepare or get things together. And University of Kansas had a summer program that I participated in. And it actually prepared you to take the MCAT, because that was the other thing. I just went in and took it, never really studied for it, never prepared for it the first time around. again, thinking I'm that good. And it turned out when I went through that summer program, it opened my eyes to say, I really should have done this very differently the last time around. So with that program, I retook my MCAT, got a lot better scores, and I applied again, this time to more schools. It still probably is not comparable to what you guys apply for today. I think it was only 10 at that time, because I know now you got to do like 50, you know, the way it kind of works because of how, not that it wasn't competitive then, it's just it was competitive and they just didn't accept anybody for anything. So we called ourselves the Jaydocs. So that's a little play on the Jayhawks. And so my time at University of Kansas, it was a shocker for me. As you remember, I was from the south side of Chicago, and then I moved here, and then I went to Kansas. Sounds right? So it was that was another growing experience for me, because I was in a culture that I had not been exposed to. I mean, even though it's the Midwest, I'll tell you, Kansas is nothing like Chicago. So this is the first in a series of times where I get pulled into being the face of something. And you're going to see that as a theme as we go through here. So this is me in medical school. No gray. So you see what happens. As you're thinking about doing this, make sure you think of this picture and then think of this. Okay? And understand that the process can be very tedious and might change your looks. So this was a mailer that the school sent out to a lot of their alumni, and they asked me to be the face of their mailing campaign. And so after I left medical school, I went to this hospital called Brooke Army Medical Center. It's in San Antonio, Texas. And I did my residency in internal medicine, which at the time, you know, I knew the reason I chose internal medicine was because I knew I would have other options and maybe be able to specialize in something else if I was thinking of doing something different. So I really enjoyed my time at Brooke Army Medical Center, so much so that after I finished my training there, I stayed there as an attending to actually help train within their residency program and take care of patients. But during that time, when I left my residency, I'm going to rewind a few minutes. So remember I said that decision to actually sign up for the scholarship and knew that I wanted to serve my country as an option. That was in 1997, okay? So when I finished medical school in 2001, I entered my internship in June. And what happened about 3 or 4 months later? 9/11, right? So not only did I have to adjust to becoming a medical resident, I also had to adjust my mindset to our country actually being at war and us having possible future conflicts. And so when you go back to that picture of that little kid in Chicago, remember that, right? Do you think he could have predicted that he'd be standing in the middle of a desert in the Middle East reading an X-ray? No, right? So, I mean, I think about the path and the route that I took, and as you make choices and decisions, you have to make sure that you're doing them for the right reason. Because that's why I shared with you, I don't think this path is for everyone, the military path, but if it is for you, it's probably the most rewarding thing that you'd ever do. I've talked several times about pivotal moments in my life, and this was another one. This is where I tell people I really grew up, because I had to be in charge. I had to take care of soldiers and train medics and save lives and all of these things that you just don't know you can do until you're actually put in that situation. And so much so, again, remember I told you about that theme, they decided to feature me in several of their articles that they were sending back to the States at the time when I was in Iraq. When I came back, I said, okay, now I think it's time to make those choices of if I'm going to subspecialize or go into something different. And at that time, I chose nephrology, which is a study of the kidneys. And the reason I did that is because just like I can't stand still here, it's hard for me to stand still in an office. And as an internist, I felt like I was doing a lot of clinic work, and occasionally I do hospital work, but it just wasn't enough of a variety. So if you know anything about being a nephrologist, we actually go to dialysis centers. We go to our patients rather than our patients coming to the clinic. We also do have clinic time where we see patients in clinic, but there's this variety of doing inpatient medical care, going to dialysis centers, and having clinic. So for me, that fit me well. And I really liked how challenging. Who's ever learned about the kidneys before? Is it easy? No. Raise your hand if you think it's easy. You see, I'm even going to put my hand down, right? So, I mean, I really did like the challenge of learning something and feeling like, and I always joke with my students at Western and say, you know, you're going to feel like a Jedi after this, you know? Because, I mean, you feel like you do magic that no one else understands how you're doing it. So that was some of the reasons I actually chose nephrology. I moved to Washington, D.C. at that time and did my training at Walter Reed, which is now a joint hospital between the Army and the Navy in Bethesda, Maryland. I think it was a very valuable training. I got to see things full circle because this happens to be one of the major hospitals that after the soldiers got injured in Iraq or Afghanistan, they'd come back here. So I also got to see what happened to those patients as I would send them out of the theater and where they would actually go. Again, my Whittier College caught wind of all the things that I was doing, and they asked me to be featured in their mailer that they were sending out to prospective students. And that's me, again, a little more gray. I gotta find this. I think this is the pointer. I mean, it's starting to come in there in this area right here. So, there we go. From after I finished my time with the military, I knew I loved teaching. When I was at Walter Reed, there was our military medical school was right there in Maryland, and so I taught there, and I knew I had caught the teaching bug at that time. And so every job that I was looking for to come back here, because my parents live here, I wanted to come back to Southern California. I looked a lot of places. I actually interviewed at USC. I interviewed at UCI. I interviewed at Western. I hadn't been such a big researcher. I was really, really focused on teaching and engaging students. And of those 3 locations, I felt like Western U actually had that focus on the student, and I would get a lot more time to actually spend molding, mentoring, and guiding them. And so I chose to work at Western U. I am an adjunct faculty at UCI also, where I teach in their fellowship program. The other part of choosing this position was starting a new practice called the Western Diabetes Institute. Both of my parents have diabetes, and they've had it as long as I can remember. And I thought this would be a perfect opportunity to engage and make an impact on a disease process that I thought was important. And so the whole concept behind the Institute is myself, an endocrinologist, we have a nutritionist, we have a PharmD, we have a podiatrist, we have a physical therapist, and we all coordinate around trying to we have a dental hygienist. And yay, because we also recognize the importance of dental hygiene with diabetes control. So we all work as a team to help diabetics and use skill sets like motivational interviewing to inspire them to improve their lives. So with those 2 entities, it was a perfect fit for me. And again, so after being there a few years and us starting our marketing campaigns, we have these billboards across the greater LA area. And if you go to the Ontario airport, you may not have known that was me at the time. It's funny, I could be standing right next to it, getting my bags, and people don't even care. But, so that's at the baggage claim at the Ontario airport. So if next time you're there, you're like, I know that guy. I get texts from like high school friends. That's basically it. All right. So who knows who this is? Yeah, who's that? Oh, no, your name's Matt. Yes, I get that. Who's that? He is from Greek mythology. What's his name? It's not Atlas. Atlas has the Hercules. No, it's not Hercules. Good. I'm going to teach you guys something today. His name is Sisyphus. Okay? Sisyphus was a king. He got punished. And what Sisyphus' punishment was to push this rock to the top of this hill. What do you think what happened to that rock every time Sisyphus pushed that rock to the top of the hill? It would fall back down. That's a pretty big rock, right? Imagine being punished to do that over and over and over again for eternity. You're gonna feel like this. So as you start thinking about, I want to go into the health professions, I want to do this for my life, you have to know this part of it. You're gonna feel like this. Who wants to go into a health profession to make a lot of money? You guys have all been practicing your interview skills, I can see. Right? So, but a few of you were honest and said yes, so that's good. I mean, it's just not as true anymore. You can help me. Yeah, I mean, you make money, but you also have a lot of debt, right? So when you make the decision to do this, you have to have a reason why you're doing this other than, hey, I'm going to be inspired by making a lot of money, right? So when you get at those times when you feel like Sisyphus, you got to come back to your anchor of why I started to do this at all. So this section called the reason, or basically my reason. Your reasons aren't going to be the same as my reasons, but it's okay. There might be some similarities. Look what we have done. You could go back to when I was a kid, 1970s. Look at how our children have changed. There's been this metamorphosis of our culture, of our environment. And we know we have great technology. We know that we have a lot of wealth and opportunities and easy access in our country. But the results of those things may not match what we actually intended. So this was one of my incentives to say, okay, how do we change the outcome of this child? How do we change the trajectory of this metamorphosis? So diabetes is a huge, huge problem, probably bigger than we even know on this chart. And we're talking about 2010 and 2012, but look at where we're going to be in 2050. 33% of our population are going to have diabetes. Is diabetes preventable? Yeah. I mean, there is a genetic component, don't get me wrong. And you may hear the excuses from the patients, it's my glands, right? But in the end, the numbers don't lie when we're rising at this rate, right? It's not that we're diagnosing it better. I mean, that was for a time, but that was in the late 70s, early 80s where we made that transition of knowing how to diagnose it better. This problem is not, hey, an early diagnosis problem. This problem is a change in our culture and the way that we operate. And then when you break it down to different ethnicities, you can see that there's a big difference. when we talk about communities that might be considered underserved. So when we think about what the reason, for me, I come back to this. This is why I keep pushing that rock up the hill. And so when Pierre and I met, we were at a separate conference. And I'm not going to make you guys do this, but this is a pledge I do for students who are entering medical school. Because I feel like this is a very valuable reason to actually enter into this honorable profession of providing care for patients. And the pledge goes as, I will value the unvalued. I will appreciate the underappreciated. And I will serve the underserved. And the reason I say this pledge, the reason I believe in this pledge, is because it's the same reason I started on this journey in the beginning. It's the same reason I keep pushing that Sisyphus rock up the hill. Even though I get tired, and sometimes it rolls all the way back down again, I have to bring myself back to my reason. So I want all of you to think of your personal reasons. Go home tonight. Write them down. Keep them somewhere. Because you're going to need them if you're going to say, hey, I'm going to go into this health profession, and at those times where you don't get the grade that you thought you should have got, or you're too tired to even really get up and go the very next day. You're going to need your reason to actually fall back on, to actually get back up and start pushing that rock. So this is an easy question. What's this? A wave. See, I knew you'd get it. So a wave can be very impactful, right? It has an immediate impact. It can be very strong, but it really dissipates right there almost immediately. So there are some people in our world that are waves, and we need those at times. We need the waves. We need people to come in, impact, and get out and make the change that we want to see. But what's this? A ripple. And what's in the middle of that ripple? A bee. That bee is small, right? So why do I use a ripple? Because the smallest bee can reverberate across a very large sea, right? I just rhymed. I didn't mean to do that. I feel like by coming and talking to you, by teaching the hundreds of students that I teach every year, that I'm not only impacting those students or those future medical students or pre-health students, I'm impacting every single patient that they're going to care for in the future. So even though I may not be making the biggest splash as a wave, I feel like I'm making a ripple. And that means that every one of you now are one of my rings. So what I ask of you is that you go out there and you make me proud, not only get into the health school of your choice, but once you complete it, you do similar things that I'm doing, and you take great care of your patients, because I have no voice, and I still came here to talk to you today so that my ripple will continue. Thank you.